Alrighty. And occasionally I may need to stop to let people in from the waiting room, like this person who's coming in right now. Okay, so this is the end of the four-part series that I put into the training this year, really about relationships, how to manage relationships and what are the cycle of relationships, how to talk about sex and sexuality in relationships, and also how to for this one, I wanted to talk about how to deal with relationships that are broken. So, the last time we talked about forgiveness and healing and reconciliation. And today we're going to talk about how do you build trust again after having a broken relationship. I initially conceptualized this around alcohol and people wanting to build relationships with their family after they've achieved sobriety. But it also is very pertinent in child welfare or any situation in which a person has had to break off a relationship with a family member or the larger family. So also think about this in child settings as well. So as usual, here are the training requirements and policies. Again, you've been in here all year, so you know what they are. Here are the learning objectives for today. We're going to explore methods for reconnecting with loved ones after acquiring sobriety or regaining child custody or wanting to reconcile with a member of your family or a part of your family where there's been broken relationships. And then we're going to talk about the topics for discussing these methods with clients. So there are a few very specific things that folks need to be able to do to rebuild trust. We're also going to watch a longer than usual video. It's a 15-minute video, but it is developed by people who had mental health or substance use problems or child custody problems or all of the above and were able to reunite with their family. And I thought that their stories were so important to hear that I'm going to want you to watch that whole video today. So, the biggest thing about reestablishing a relationship with someone with whom we have a broken relationship, a misunderstanding, um, more dramatic issues such as substance use or a mental health issue or child custody issues, the bottom line is rebuilding trust. And trust is something that doesn't happen one time. It takes time and healing in order to rebuild. And sometimes folks don't want to rebuild that trust with you because they don't want that relationship with you anymore. And so, what do you do in that situation? So many clients want to reconnect with loved ones after these adverse experiences they've had or behaviors that they've engaged in, and developing positive and realistic expectations for doing so is really challenging. So, we're going to look at some of the key factors that are going to lead to client success and hear those client success stories from the video. So, today, I want you to think about a client or a family you've been working with where rebuilding trust is challenging. It's really hard to do. Think for a minute about what got in the way of reconnecting. What behavior on the part of the parent or the other family member was difficult and got in the way of reconnecting? And when you're willing, share with your voice or in the chat any of these stories.
I think for me, particularly like in my internship
Mhm,
in the residential unit in the SUD,
mhm.
yeah, in the SUD unit, a lot of times in the educational groups, the members will share, you know, that they've essentially like burned a lot of bridges with their families, with their
Yeah.
friends, um, and some of them still have like that open that communication with those family members and friends, but a lot of the times members don't have that, and they come in knowing that's a relationship that's not available for them to go back to. So
Mhm.
yeah, I just wanted to
Yeah.
share that.
Thank you. Yeah, sometimes the relationships aren't available. Recently, I was working with someone who was seeing a person who wanted to reconnect with a family member. And when they tried to go back after 6 months or a year to reconnect with the family member taken out a restraining order on them and was clearly not in the space or wanting the desire to reconnect with that person. So um, that's disappointing, obviously, to the person who's in recovery or who's in treatment and is managing their life much better. And part of recovery is accepting those losses and being open to having that connection at some point in the future if the other family member wants to reconnect. Other stories, and I'm sorry, I have to shoot the chat up so I can see it. Thank you. That was Carmen, right?
Yes.
Thank you, Carmen.
I know sometimes working with the very ill, like schizophrenia, bipolar, some of those more severe diagnoses that have psychosis or manic states,
Mhm.
there sometimes is the history of criminal restraining order kind of getting in the way of it, where even if they do want to mend the relationship, the parents are afraid to take off the restraining order, but that gets the clients in more trouble because then they just violate it when they misbehave and allow it
Yeah.
when the client is behaving, which makes it difficult for the client to understand when it's appropriate and when it's not appropriate to come by the family.
That is a very important thing to realize, and thank you for those comments. It is common for parents to have, or family members to have restraining orders against those who have severe mental illness or who've engaged in SUD and whose behaviors have been dangerous to the family or loved ones. And you're right, people are reluctant to withdraw those restraining orders because they feel like and it is one of the few things they can do to try to provide themselves some buffer and some protection. And yet, many times they do want to have contact with the person against whom they have the restraining order, but then that's a violation of the restraining order and can be used. And it is very confusing for many clients, particularly those that are struggling with cognitive issues as a result of substance use or mental illness or reality testing. So that is a challenging situation. So thank you for sharing those. I'm going to make my chat go away for a minute. So before folks reconnect, they have to do their work. They've got to do their own treatment plan or their care plan. And sometimes this takes 6 months to a year or longer. They've got to be in a place where they are stable enough to process the rejection of their family member if that family member does not want to see them. So sometimes we'll say to people, somebody say, well, I want to reconnect. And I'm thinking of folks that are seriously mentally ill or using substances or in recovery and want to reconnect with family. They want to share their sobriety story. Parents with kids in care, they want to see their kids again, but they've got to have the strength to deal with that rejection. And we'll say, well, hold off. Let's talk this through. What are your expectations? So it's really important in treatment to talk with folks about their expectations and role play various scenarios with them so they can think through what their response is going to be, whether their loved one says sure or says never or says not now. It's really recommended that folks in this situation obtain ongoing support for the process. So they should either have the support of a therapist or a support group. And there are tons of support groups in the community for free that support parents in this situation. And I'm going to show you one of the groups that's a nationally, actually, based in Massachusetts, but it works with people nationally because it has online support group meetings. Folks have to be able to talk about forgiveness and self forgiveness. Self forgiveness is being able to integrate the previously unacceptable characteristics or behaviors you demonstrated so that you accept all of who you are and you won't engage in self sabotage, self defeating behaviors, self harm, go back to substances, etc. So that's a process that needs to be worked through as well. And folks need to engage in self compassion. Let's talk for a minute about what self compassion includes. There's three basic components to it. It's self kindness versus self judgment. It's the idea that we all make mistakes And we have to be gentle with ourselves instead of getting angry with ourselves or blaming others for the difficulties that we're having that are self-induced. But just honor, own your stuff and honor it and honor that you're a human being trying to make progress in the world. The second pillar is common humanity versus isolation. So it's recognizing that we're all human and that we're all imperfect and that we're striving to do our best most of the time. And that we don't engage in isolation or pulling away from people because we think that we're not good enough, or that we have to be perfect before we try to reconcile. And the third pillar is mindfulness versus over identification with negative thoughts and feelings. So we talk about mindfulness all the time. It's one of the ways that the brain heals, and it's not like taking a pill. It takes a long time, months to years, for mindfulness to be able to help change those neural pathways to more positive associations, more positive outlook, and a lower cortisol and adrenaline in our system so that we're not feeling angry or anxious. So it takes time, but it's worth the trip. So, working on balancing emotions versus over identifying with negative thoughts and feelings. And when I was researching this, I found this really cool graphic that I just wanted to include because it was so pretty. And it's something I would put up my wall if I wasn't working virtually. So it is Self Compassion 101, self kindness, mindfulness, and common humanity. Hopefully, you can print it out and maybe put it up in the wall in your office. So, the three things that we have to engage in order to um, reconcile with families after doing all of our own work is rebuilding trust, developing open and honest uh, pathways of communication, and then engaging in healing activities. So, I'm going to talk first about rebuilding trust. And this is challenging. And hopefully clients are talking to you about who they want to reconnect with and what their challenges are so that you can talk them through this, role playing all the different eventualities about the reconciliation, and then role play with them how to do these activities. Folks who may not have had these skills beforehand need to build these skills now. And one of the things is to invite a conversation with the family. Um, I know folks get really excited about reconciling, or maybe some people are really scared about it. So invite a conversation rather than say we need to have a conversation or I want to have a conversation. um, just ask people, would I would like to talk to you about X, Y, and Z, would you like to have that conversation? So that would be a way for a person reconciling or trying to reconcile might approach it. And one of the things that's important is not only to express your desire to reconnect, but also your commitment to staying in treatment and support groups. And yes, people are human, people have relapses, people continue to have struggles with mental illness, but it's a commitment to stay in this process of their own healing that's really important to communicate to the family members that they want to reconnect with. Apologize and be patient with that family member to reconnect with. Trust has to be built, it's not a one-time act. Practicing honesty and accountability. um, Engage in openness and honesty and a willingness to take accountability for past actions. Um, you don't have to provide an excuse for it, but you need to acknowledge the pain and the challenges that you may have caused in past relationships with family while you're telling them about your recovery and your personal growth. Sometimes an apology is made with the expectance or expectation that the other person is going to accept their apology. You need to coach people in this process that they might not get that, and what does that mean for them if the person is not going to provide forgiveness or want to be in a relationship with them. And this process needs to be matched to the age and developmental level of any children involved. So what you say to a 16-year-old is going to be very different to what you say to a 6-year-old. So the accountability is about owning what you did and not saying, yeah, but it was the drugs, or yeah, but it was this, or yeah, but it was that. Just saying, I know and I'm sorry. And using an apology to be honest with the person. And you will see that in the video as some of the folks are talking about their story. This final one is good advice for anybody. in real life is to make sure you follow through on any commitments. This is like putting money into the trust account, right? Keeping those commitments. The big thing folks need to learn to do is to not overcommit, not to make a promise about something they can't guarantee. So you need to coach your clients around that kind of activity as well. The next is engaging in open and honest communication. And gosh, we've talked about some of this early on in our trainings last September. The first is active listening, right? You've got to be able to listen to the person, not have any distractions around, turn off the TV, maybe going for a walk. Is a really good way to talk about some of these challenging things. And as we learned in a training that some of you may have attended last Friday, is you can have these challenging conversations more successfully if you sit side by side rather than looking right at one another, because this is much more um, can be perceived as aggressive, and it's certainly much more intense. So go for a walk, go for a ride in the car, go someplace where you can chat, where you don't have to look straight at each other. But give your family members space to express their feelings and concern, and be a good listener and show empathy for them and all they have done in the past to support you, and what they might be able to do to support you now. Or if they can't support you now, have empathy for that process and honor where that family member is at this point in time. It's important also to open up and express gratitude. Gratitude is often paired with self compassion because it is a good way to engage in mindfulness and recognize the things that bring us joy or that we're thankful for. So let people in your life know how much they mean to you, and that. And thank them for being willing to reconnect if they're able to do that. So just be thankful for them, be thankful for the relationship that you've had with them or will have with them, and let them know that. The fourth thing is to set boundaries and especially manage expectations. So be clear about your boundaries and communicate them respectfully. So, for instance, if somebody's in recovery from alcohol and they struggle to be around other people who are drinking, it triggers them to drink. They might have to say to a family member, I would love to meet with you, but let's go for a coffee and not a beer because I really can't be around beer. So that's a respectful way of setting a boundary. Um, and be clear about them. So what your triggers are. Don't be afraid to talk to people about your triggers and say, I need to do it this way because of this trigger, and see how the family member takes that. And if the family member also has some requirements around reconciliation, listen to them with empathy, and begin to go through that healing process. And it's also important to manage expectations by recognizing that some relationships may never heal, and it may take a long time to heal, and it will take a long time for people to build trust again with you or with the person who's going through this process. So just be open and honest with it. And I think you can see here, you can't have these kind of communications with the client unless the client has done a lot of their own therapeutic work, or unless the client is learned to engage in self-compassion or a mindfulness-based stress reduction, or some kind of activity where they're not triggered by having the conversation. So if you get through the first two things about building trust and being open and honest, you can engage in some healing activities. So there are lots of things people can do before they turn around and have a full-on relationship with the person that they want to reconcile with. So plan activities. Plan activities that everybody can enjoy. Create positive memories with the person that you want to reconcile with, even if it is a half-hour walk or a 20-minute cup of coffee. Having that kind of experience that's positive goes a long way in healing both the person who's trying to reconcile and their family member. If you're working with families, help them reestablish or establish family rituals and traditions to create a sense of togetherness. Maybe everybody has maybe have spaghetti every Saturday night or pizza every Friday night, or maybe on Saturday mornings everybody eats cereal together while they're watching TV, or something like that. It doesn't have to be a big ritual or a big thing. Start small. Start with something you know you can achieve and that the client can achieve, in building those positive memories and establishing rituals. It's important to celebrate milestones and acknowledge achievements and include family with them. Have clients include family with them in these activities of these milestones and achievements. Some family will be interested in doing that and some family will not. um, a lot of people talk about their sober birthday that are in recovery from drugs and alcohol. Maybe they can celebrate a sober birthday after a while, or a sober 6 months or something like that. So include family in milestones and express your appreciation for their support and encouragement. Once trust is built up and you engage in some healing activities, um, you will have time to express appreciation and finally will begin to support and encourage you. Always engage in therapy and counseling and find support groups. Consider family therapy or family counseling to address underlying issues or improve communication if that seems to be a barrier. And absolutely join support groups or have your family join a support group or have the family member you're trying to reconcile with join a support group with you or connect with other people that have faced similar challenges. So I'm going to stop here and ask folks, do you have any comments or any observations about these activities of building trust, open and honest communication and healing activities? In what ways does this sound like a healing process, or in what ways does it sound off to you? So I guess you're all tired today. I understand it's late. Is it getting warmer there? I think it's getting warmer there too. So what we're going to do is we're going to move to the video, and I put the video in the chat so I can get that in there. But before we start, let's talk about it for a minute. These parents have been successful in reconnecting with family after major mental health or SUD treatment. And as I said, the video is about 15 minutes long. As you watch the video, think about how stigma has affected these folks in their journey, because it is a big part of the journey. There's stigma anyway, and then there's cultures that have even more stigma about mental illness and about substance use. And think about how you might flip the script to engage them in more self-compassion. So maybe think about that client you've had who's thinking of reconciling with a family member or wants to reconnect with their children, either youths or adults, and think about the things they say that are, I can't do this, or what happens if. Think about how you can help them use self-compassion to flip that script. So I am going to take myself off of audio and video so that you all can watch that video on your own, and I'm going to watch it at the same time. So we're synced up with our time. Okay, we'll give it another minute or so for folks to come back. So I think a couple of things to recognize about this video. Since most people talked about losing jobs, my assumption was that they had jobs, and so they were a different socioeconomic status than many of the people that we see at BHRS. Folks are there because they have Medi-Cal, and that's only for people who are at the lower end of income. So it looked like the people in this video did have more supports than many of the folks that we deal with, particularly around housing and some of the other financial issues. I wanted to point that out, but they said some really profound things. And now that you've seen this video, what are your thoughts about what you would work on first with folks in this situation of wanting to reconnect with family? What are the things you want to make sure that you talk to them about? One is how to deal with stigma. Absolutely. And these parents, I think, to me, it was clear that they've already done a lot of work on themselves and are in more stable places than somebody who's kind of raw or just right out of treatment or just right out of sobriety. So, yeah. What are some of the other things that you would talk to them about or that you have talked to with folks in this situation?
Can you rephrase the question again?
Sure. Of these things that you heard the parents talk about today, for instance, one of the ladies said that she didn't, because her kids were adults, her therapist never talked to her about reconciling with children. Now that you've talked about building trust and open and honest communication, healing activities, and then heard these stories, what would you want to be able to work on with parents in this situation?
It sounds like developing those communicational skills, because it is a tough area where their adult children or their young children might lash out at them or not be at the same level after the parents have had treatment. So maybe providing the parents resources and then for the kids to be able to involve them, but also communicational skills and boundaries because it's a very tricky area to rebuild and mend relationships.
It is. And some other folks in the video talked about the age of their children and what they shared with their children at this particular age versus what they would share with what sounded like a gentleman was sharing with older teenagers or a transitional age youth in his family. Let's talk about some of those community supports. I'm gonna minimize this right now and go to the next slide. Um, so there are this video came out of Massachusetts, and the support group was also affiliated with them. And you can copy this link, and let me put it in the chat as well, so that you can go to what I thought was fascinating because they had online parent support groups. So let me just share my screen for a second. Virtual parent support groups. And I looked at the weekly group schedule. And I mean, gosh, look at all these different kinds of groups. Parenting children with anxiety, depression, parenting recovery, father's group, mother's group, foster parents, Parents with children in foster care, parenting preschoolers, parenting neurodivergent children, teens with special needs, parenting as a BIPOC person. So this one group has all these different, this one organization has all these different groups, as well as, let me dismiss this so I can go back. Um, there's a parent stress line that they can call. So gives their approach there about their impact, et cetera. What are some of the organizations in the Central Valley that you know of that provide or that might provide these services? What have you found in the community that works with parents, whether it's a parenting class or parenting support group? I mean, we have parent partners in Children's System of Care, folks who work for BHRS who are parents themselves and help parents with their parenting skills. What organizations might you look up to see if they provide these services?
They have resource communities, like where for parents that they provide parenting classes, like support with funds sometimes. They're like resource centers. And
Family
Modesto
resource
has,
centers.
yeah, the resource centers. Sierra Vista, like through your insurance, you can get support through insurance, Medi-Cal if you qualify.
Mhm,
Um, uh, Parents United, sometimes even if there's
mhm,
history of sexual trauma.
mhm.
Um, that's all I can think of right now.
Yeah, I'd even call places like Without Permission that works with CSEC victims to see if they have any parenting groups. Um, the Parent Resource Center is super helpful. In other counties, in San Joaquin County, I know the Child Abuse Prevention Council does a lot of this kind of work. In other counties in the Valley and in the foothills, you might find something called First Five, which focuses on kids in their first 5 years of life. They're going to have some parenting resources. I would also look up AA and NA and see if there are any specialty groups for parents who are in recovery. Um, I would look at some of the treatment programs, such as is it Redlands or Redwoods? I always forget the name of it. To see, do they have any resources specific to parents and follow-up care specific to parents? So there are a lot of organizations who may just maybe have a class. It's not something that they advertise widely, but when you're looking for these kind of supports for parents, I think it would be helpful to just kind of dig deep and look for those supports. And one thing I wanted to mention about the movie was flipping the script. How can you help this person flip the script on stigma and self-blame? And one of the gentlemen, I'm going to change slightly what he said to, um, we need to talk to people about what's strong with you rather than what's wrong with you. And I would use that in any kind of setting where I'm working with an individual who feels that they're not able to meet the necessary requirements of their family and their life. So I think we've already talked about this. What technique or resource from this training will you share with people when you see them yet next? Think about a resource center you can look up with your client or a technique to talk about with your client regarding their negative self-talk or self-compassion or building trust with their family. A resource that I don't think we use enough is the podcast world. There's a podcast for everything, and there are dozens and dozens and dozens of podcasts for parents and for parents in recovery and for parents with issues with serious mental illness. And even if they don't come out every week, they'll come out once a month sometimes. That's also a good way to find online resources for parents and support groups for parents. And everybody's got a phone these days. Most of the time, everybody's got access to those podcasts. So they're not just relying on you for help, but they're finding their communities that they can have outside of therapy to help them with their recovery and reconnecting with family. So thank you. This is all I have for today. Like I said, I don't like taking you to the very end of your workday. Our last session is in 2 weeks. It's going to be on Tuesday, April 22nd at 3 p.m. And we're going to talk about alternative treatments for a number of different mental illnesses that don't include either talk therapy or medication. So we're going to talk about something called neuromodulation. We'll talk about biofeedback, and we'll talk about EMDR. So I hope to see you all there. In the meantime, have fun wrapping up your internships. Congratulations to those of you who are graduating, and I hope to see you in a couple of weeks. Bye bye.